Saturated fat is not associated with an increase of subclinical atherosclerosis, or development of plaque or thickening of your carotid artery, according to a new study. Now, this is controversial, right? Because we've been taught for so long that saturated fat is dangerous, is bad for your health, is bad for heart disease and vascular disease, period. We've been told that time and time again. But one thing that we've been trying to point out is that the vast majority of that data is based on low quality nutritional epidemiology studies where you can't prove cause and effect, where there are so many confounding variables and healthy user bias and poor data acquisition and razor-thin hazard ratios. The data we have really doesn't support the strength of the conclusion that saturated fat is de facto dangerous for vascular health. Now a new study gives us more evidence that that's not the case. I'm Dr. Brett Scher, the medical director at DietDoctor.com, and I really want to go over the study because it's so important to point out when we have evidence contrary to sort of the common belief or the existing dogma, especially when that belief or dogma is built on very poor quality evidence. So this study was done out of Italy, France, Finland, the Netherlands, and Sweden. So right away, different from the North America population, right? And I'm going to talk about that again, but it was done in Europe and Scandinavia. They were people aged 54 to 79, and they had to have 3 cardiovascular risk factors, so diabetes, high blood pressure, high cholesterol, 3 different cardiovascular risk factors. So they were considered high risk, and this was published in scientific reports. And what they did was they did a baseline carotid intima media thickness test on these patients, over 3,700 people. So they did a baseline specialized vascular ultrasound to measure the thickness of the blood vessel in their neck. Then they followed them for 30 months and repeated the scan. Then they correlated who ate the most saturated fat, who ate the least saturated fat, and what was their risk of progression of the CIMT. Now, CIMT is a good measure of subclinical atherosclerosis or vascular disease, because if you wait for heart attacks and strokes, you need trials that are 10 years long. But if you're just looking for some ultrasound progression of vascular disease, you can pick that up in a much shorter time period. And there are some studies from North America showing those who eat more saturated fat have progression of their vascular disease. But this study found the opposite. There was no significant progression. Now, on their initial data, there was a tiny increased risk, hazard ratios of 1.1 to 1.2. I always like to point out, the hazard ratio of smoking and cancer was 15 to 30, not 1.30, but 30. And here we're talking about 1.1 to 1.2, razor thin, couldn't get any smaller. But as soon as you adjusted for even just age and gender, that difference completely went away. And then if you also adjusted for smoking and alcohol and education level, then there was no association either. And this gets back to that healthy user bias that we talk so much about, whether it's red meat studies or saturated fat studies. The baseline characteristics, the people who ate more saturated fat were a little less healthy. Now, not as dramatic in this European and Scandinavian cohort as you see in the American cohorts, which is really interesting. But there were slightly more men than women eating more saturated fat. There was a little bit higher prevalence of type 2 diabetes in the people who ate more saturated fat. They had a little bit higher body mass index. They were a little bit more likely to have smoked in their history. So there was definitely some unhealthy trends towards the people who ate more saturated fats. But again, not as dramatic as we see in the North America studies, which is really interesting. Now, the other part of this study was they looked at to see if there's any genetic influence. And for the genetic tests they didn't see any genetic indications for progression of atherosclerotic disease. So how do we interpret this? Well, in this cohort, the healthy user bias was certainly present. And when you tried to adjust for that, there was absolutely no difference in progression of vascular disease with saturated fat intake. So the authors pointed out in their conclusions how that is a little bit different from some of these North American studies. And I think it's just clear that the healthy user bias is much stronger in North America, because when you look at those baseline characteristics, it's usually much more significant in terms of smoking and alcohol and physical activity and poor diet overall. And that brings us to the point that you don't just eat saturated fat, right? You don't eat one thing in isolation. You eat it as part of a whole a dietary preference, a whole meal, a whole nutritional pattern, and it's in your whole lifestyle of how healthy you are in general. So it's so hard to factor out one specific thing. But in this study of over 3,700 people, saturated fat didn't move the needle, right? There may have been some other things that could have been correlated with tobacco and age and diabetes and gender, but it wasn't saturated fat. So we really have to get over this demonizing saturated fat, demonizing red meat. Sure, it can be part of a very unhealthy lifestyle. It can be part of a very unhealthy diet. And it can be part of a very healthy lifestyle and a very healthy diet. There's nothing intrinsically bad about saturated fat by itself, according to the science, that you cannot overcome with better lifestyles. There's nothing there that actually needs to be overcome because the data is not consistent that it is harmful. And we have to realize the data that we've been relying on is a house of cards. It's such poor quality data. And we need more studies like this to show us that, to show us there is evidence that there's absolutely no relationship. So if you don't like saturated fat type foods, don't eat them. You don't need to. But if you do, and if it's part of your diet that's helping improve your lifestyle in some way, by all means, eat them, and eat them without any concern. And if you want recipes for, red meat or other versions of saturated fat, whether it's eggs, go to dietdoctor.com, where we have over 1,000 recipes. We have put together meal plans and the ability to make personalized meal plans for you to help you come up with the foods and the meals and the dietary pattern that works best for you to help you with your healthy weight loss, with your metabolic health. All right, if this was helpful, please click the thumbs up to like it, and please click subscribe and leave a comment. It helps other people see these videos, because if it helps you, maybe it'll help them as well. All right, thanks a lot, everybody. We'll see you next time here on Diet Doctor News on YouTube.